In HPV-driven OPSCC surveillance, let their blood TTMV help achieve a new standard of care with NavDx. Tumor tissue-modified viral HPV DNA, or TTMV HPV DNA, is a unique biomarker present in HPV-driven cancers like oropharyngeal squamous cell carcinoma. When HPV-positive cancer cells die, TTMV HPV DNA is released into the blood. Circulating TTMV HPV DNA is found in patients with HPV-driven cancers, making it an ideal biomarker. NavDx is the first and only clinically validated circulating TTMV HPV DNA blood test that aids in the detection of HPV-positive cancers. NavDx utilizes a highly sensitive proprietary technology to accurately quantify circulating TTMV HPV DNA fragments, is a clinical-grade test performed by our CLIA-certified and CAP-accredited laboratories. NavDx reliably distinguishes TTMV HPV DNA from non-cancerous sources of HPV DNA. Monitoring patients' TTMV HPV DNA scores with NavDx at routine surveillance visits demonstrated unrivaled test performance metrics. In particular, with greater than or equal to 97% specificity and 89% sensitivity, NavDx accurately detects true disease status. And NavDx delivers greater than or equal to 98% negative predictive value when TTMV HPV DNA scores remain undetectable, and greater than or equal to 95% positive predictive value for recurrence when patients have one positive test result. With unrivaled NPV and PPV, serial testing with NavDx can help you detect recurrence early at the molecular level, enabling providers to optimize the use of imaging by mitigating the need for unnecessary imaging exams. In HPV-driven OPSCC surveillance, NavDx, with its high PPV, can reduce the risk of unnecessary invasive procedures, whereas its high NPV can offer your patients greater confidence in their response to treatment and current disease status. Since its release, tens of thousands of NavDx tests have been performed in our clinical labs. Using NavDx in your practice enables you to optimize the clinical management of your HPV-positive patients by confirming the tumor HPV genotype, assessing treatment response, identifying molecular residual disease, and detecting recurrence significantly earlier than standard surveillance. Optimize HPV-positive cancer surveillance with NavDx. NavDx reliably informs disease status, enabling providers to intervene earlier with imaging, physical exams, and salvage therapy, and reassure patients their disease is being effectively monitored. To learn more, speak with a Naveris representative today.